leaders of the opposition parties today have hit out at the centre. This over reports of several people, 17 or so in the national capital, being arrested. Their crime? For allegedly putting up posters that were critical of the government's handling of the COVID crisis. The Congress's Rahul Gandhi this afternoon first tweeted "Arrest me too" in both Hindi and English, along with the white Hindi words on that black background, that poster that led to the arrest of those 17 people. The original poster simply read, "Modi ji, why did you send vaccines meant for our children abroad?" Since then, 17 people have been arrested by the Delhi police over these posters that came up in parts of Delhi over the past few days, criticizing Prime Minister Modi's handling of the coronavirus pandemic. The Delhi police, which reports to the Union Home Ministry, has said that it has also registered around 21 cases under the Defacement of Public Property Act and Section 188 in the matter relating to the posters. This is according to an ANI report. And since then, opposition party leaders have been retweeting this poster saying, "Arrest us too." In fact, one of the tweets says, "Busy with election rallies and building the central vista, the Modi government didn't have time to plan for vaccines, but it has time to arrest the poor." Asking about this, the CPIM has tweeted, repeating the line, "Why did you send our children's vaccines abroad?" So, as India grapples with this massive surge in COVID-19 cases, with a shortage of beds, a shortage of oxygen, with increasing fatalities, all of this just compounding our problems, the question being asked is, instead of tackling the pandemic, is the Modi government's priority instead countering the criticism and the bad press? Well, for now, let's go across to Adil Singh Boparai of the Congress, and we have Deshratan Nigam, a political analyst with pro-BJP leanings. Mr. Nigam, I want to just put across to you what the CPIM has tweeted. Is the priority addressing the PR image of the government right now? Was there really a need to arrest, to shoot the messenger, those people who were just putting up these posters in response, asking questions that honestly, so everybody is thinking, everybody is wondering about?
Sarah, let me tell you one thing very clear. This government is not managing the perception and the PR the way it should have. And that is why you see the perception which is being built by the opposition parties to some extent has been successful. So I criticize the government for not managing the perception, although they are working on the ground.
So you agree with the government that managing perception is important in the middle of a pandemic?
Let me tell
when you have bodies flowing up in the Ganga, is it important to manage perception?
No, let me tell you, they are not managing perception. That is what my point is.
But you believe that they are focusing their energies on managing perception?
No, not at all. And that is the exact criticism I am doing. Although governments, the way the opposition is managing perception, the government's job is also to manage perception along with the work that they are doing. Now let me point out the question which is being raised is, हमारे बच्चों की वैक्सीन विदेश क्यों भेज दी? First thing, this is not children's vaccine because children's vaccine has not yet been approved. 12 to 18 years old, the trial is still going on. The question itself is very wrong and wrongly phrased.
Very valid. Correct.
And secondly, let me tell you, this is about at this point of time, this is not a question. This is about rumors without understanding the answers which are already there in public domain. India is being a part of COVAX group, Gavi group, and getting raw material from abroad is obligated to send this vaccine to various countries. Otherwise, the raw materials and other things would have been stopped. You could not have even produced your own vaccine. We don't own Covishield. We only own Bharat Biotech. Please remember that. Other vaccines also we don't own. So this is not even a question to be asked. You ask a valid question, understandable.
So can I ask a question? So you talk about misinformation, but wasn't it the Prime Minister who said that India is, exporting vaccines to other governments? India is coming to the aid. This is called global diplomacy.
Yes,
At the same time, you're saying right now that these were obligations that India had. So was that also misinformation?
No, that is not misinformation. It is a part of your what is diplomacy. Diplomacy is also to adhere to your obligations. It is not only that you do charity. Please remember that. So today, India is on the verge of tackling this pandemic. The cases are going down. This is not the time to misinform the public. The question is itself not valid. The question itself is full of rumors and misinformation, as I rightly pointed out. You know, we can hear hyperboles and everything coming out from opposition. It's all right, but this is a time to be united and fight it out.
All right. I'm sure Adil Boparai has lots of questions. Time to be united and fight it out. Yet parliamentary party committee meetings are not allowed to be held. So I'm not sure really how the centre is taking the opposition on in this fight. But Adil Singh Boparai, before you make your comments, I want to... Mr. Nigam here has made one point. He says that the opposition's perception, PR image, or what they're trying to make the government look like they aren't doing really a good job, pointing out that is a rather silly question. There are no vaccines for kids. In all seriousness, at this point, putting this message up on Twitter, come arrest me, isn't the opposition's attack on the government also really limited just to Twitter? How many people in India are even on Twitter?
Well, Sarah, first and foremost, it's become a crime in New India to seek accountability. The message being sent out by Narendra Modi and Amit Shah is loud and clear. If you seek answers from us, we are going to throw you in the jails. This is the answer. And yes, this is a legitimate rouse of Indians across political affiliations. Let me point out to Mr. Nigam that why were vaccines exported when there is a domestic shortage? Now, experts have unanimously come to a conclusion that the only way to defeat this virus is by vaccinating maximum number of people in the shortest duration of time. So therefore, under these circumstances, we are not against helping other countries. But first, you must put your own house in order. You must defeat this virus at your house. And coming to the very specious point raised by Mr. Nigam, Sarah, you and I and Mr. Nigam, we may be adults, but we are all children of Mother India. We are all children of Mother India. And therefore, as children of Mother India, we demand to know that why is there an acute shortage of vaccines? I can't get my brother vaccinated. He's 25 years old in New Delhi. There is this shortage across states. The problem with this government is that they believe that they can manipulate public perception.
Sorry, Mr. Nigam, I'm sorry. There is absolutely a shortage of vaccines in many, many states.
Can I respond?
I agree.
So let's not nitpick over that, sir. This is absolutely horrendous. There are people who've had their first doses. They haven't gotten their second. My parents alone in Kerala, it was a huge fight to get them to get their second. So let's not, I don't want to bring this debate down to that level. So there is a shortage of vaccines across the country, across states.
I'm not saying so that it is
all right.
not.
Adil Singh Boparai, please carry on.
The problem with this government today is that it has buried its head in the sand. The actual number of fatalities is over 20,000 on a daily basis. They are suppressing numbers. Bodies are being found on the banks of the Ganges and the Yamuna. They're floating in our river. Are you trying to say that all is well? If Narendra Modi wants to take credit for inoculating the citizenry by pasting his photograph on the vaccine certificate, Sarah, then he must also take responsibility for the COVID catastrophe. With power, with recognition comes responsibility. It is not a one-way street.
All right.
Narendra Modi has retreated into a shell, and the buck stops with him.
Mr. Nigam, two valid points over here. Will there be accountability? Should there not be accountability? Do the citizens of India not have a right to ask for accountability? And secondly, any government, if you can take the credit for, let's say, bringing the first wave to an end, do you also not equally have to take the responsibility if things don't pan out the way you expected?
Sarah, your question is absolutely valid and right. We are in a democracy where system of accountability and responsibility exist. And how does it function? When the elections come, if the governments don't perform, you vote them out. That is how you do it. It's not that people start on the streets and start doing riots or asking the wrong kinds of questions. You ask the right kind of questions, you will get the answer. When you say bachon ki vaccine, then you realize a mistake, then you start saying we are children of Mother India. I mean, you can understand the level of justification we all are children of Mother India. There is no doubt about it. And the system of accountability and responsibility exists. and that we are. And then 2024, the people will have a right to decide about this government. There is no doubt about it. This government is working day and night. Experts have clearly said, like Dr. Devi Shetty said, the government has moved heaven and earth. Nobody in the world, no system in the world can take the kind of numbers that are coming out from
Mr.
India.
Mr. Nigam, you said that the numbers have started to fall. Are you not concerned that we really don't have a good handle over the number of tests that are being done? You also know that there is a shortage of tests. Yes, numbers are going down, but we have to also factor in the fact that we don't know whether testing is carrying on as much as it was in the past. But that said, my question to you is this. We have this positivity campaign that's on right now. Are you not concerned that we are back in a loop? We're having a sense of deja vu, as we saw after the first wave in February and March, where we said, everything's positive. We're looking at all the recovery rates, the positive stories. It's about mental health. Isn't that what led all of us to become careless? And that's what led us to the second wave? There are reports that there will be a third wave.
No, yes, certainly. There has been fourth wave also in the world also, where some countries are facing the fourth wave. And Government of India is clearly aware of it. It's not that they are not working. A certain kind of infrastructure has been created in the second wave, which will meet the third wave as well. And COVID task force has clearly said the plans are dynamic. The Government of India and Supreme Court clearly said that they have a dynamic plan, and every day the data comes in and they are changing it accordingly to the need of the situation. So the COVID task force consists of experts, the best of the experts in the country, and they're following the WHO and international guidelines as well. Yes, there are certain lessons which have been learned in this second wave, which as and when the third wave comes, they will hold good, this government. And obviously we have to be alert like everybody else, including the opposition. Opposition's role also has to be very constructive.
Yes, Adil, 1 second. All right. Adil, please, go ahead.
Sara, the RSS has a fundamental misconception about democracy. Democracy is not a one-time affair in 5 years, that you have periodic elections and that's the end of it. Accountability and democracy is an ongoing process. Mr. Nigam, you're a lawyer, you're an esteemed lawyer, you know better, number one. Number two, today in this country, you have not been able to give dignity to citizens during their lifetime, and Narendra Modi has miserably failed to even give them dignity in death. Please go talk about this positivity campaign to somebody who's running from pillar to post for an oxygen cylinder, Mr. Nigam, or somebody who's trying to get one vial of an antiviral drug.
Sarah, just give me 10 seconds.
Absolutely, Mr. Nigam. I'm going across to you next.
You are living in an alternate world, Mr. Nigam. You're a good man in the wrong organization, but you're living in an alternate world, in an alternate reality. People are dying on footpaths, dying in villages.
Let me answer.
All right.
Let me answer.
Adil, okay. Let Mr. Nigam respond. Mr. Nigam.
What they're doing in Uttar Pradesh and Bihar. They are placing people under neem trees in this mistaken belief that this will raise their oxygen levels. This is the level of quackery.
Mr. Nigam, is this really the time for a positivity campaign? Is that the solution right now? We actually haven't heard from the Prime Minister or the Home Minister ever since the Bengal elections. We only heard Prime Minister speak in the Man Ki Baat address, and there he asked India to celebrate the positivity of Indians. As Adil Boparai points out there, sir, there are people dying in every home. Is that the message you think that would be? How will that message be accepted in those homes?
Sarah, let me answer that. This country is about hope. When there is a lot of panic which has been deliberately created, yes, the reality is very unfortunate. The pandemic comes and devastates people.
So who created the panic?
I'll tell you who created. The people who wanted to create the kind of situation, including the opposition parties and certain section of media. You know what international media is calling some of the sections of Indian media?
So when somebody is dying, not because of COVID, because of a lack of oxygen, are you saying the international media is responsible for that?
No, I'm not saying. Please understand. The positivity campaign, well, what happens in a situation where so much of panic is being created? We require hope. It is the hope which has sustained this country over centuries. It is not the panic which has sustained and carried on. So that positivity is required. It has, and look what Mohan Bhagwat said. I am a right.
Fair enough. I agree, sir. I agree with you. We need leadership. There needs, Adil Boparai, there needs to be leadership. I think that's what Mr. Nigam is trying to say. And the leader needs to lead the country with a message of hope, a message of looking forward. But Mr. Nigam, that needs to be backed up by infrastructure. That needs to be backed up by science.
Yes, certainly. There is no doubt about it. But if I look at from 2014 onwards, the infrastructure in the health which has been created, and I compare it with the previous years.
It's missing, sir, right now on the ground.
So it is
we
pandemic.
went into lockdown a year ago, and that year was not used. It was squandered. It was not used to build up the infrastructure. And that is why the Prime Minister said we are going in for a lockdown.
Sarah, let me point out, health infrastructure cannot be built in 1 year. 20 aims were built over 7-year periods. Please remember that.
So we had a jumbo COVID center that was taken down after the first wave. That was taken down in February and March. Adil Boparai.
So many jumbo centers have been set up also. Please remember, it is pandemic. Neither my generation nor my father's generation or grandfather's generation has seen it. There is no reference point.
But as you said, Mr. Nigam, as you pointed out, there are countries in the West, there are countries in the world who've had second phases and third phases and fourth phases. So we have all not lived through a pandemic, but we can learn from the experiences of other countries. Adil Boparai, last word to you, and then we have to go in for a break.
Sara, the irony of the BJP and their ecosystem is that they are in a state of denial. Allahabad High Court calls deaths due to shortage of oxygen a genocide. This is not an opposition party. Just 3 days back, over 40 Indian citizens died in a Goa government hospital due to lack of oxygen. People have died in the national capital of India due to shortage of oxygen. This is a genocide, Mr. Nigam. And history will not forgive.
But Adil Boparai, where is the opposition? It has to go beyond tweets. Why does the public, the Aam Aadmi of India, have to get sucker from the courts?
The Congress organization, our frontal organizations, we are in the battleground. We are helping foreign embassies. Can you imagine even BJP-ruled MPs are seeking help from Congress leaders? This is the state of affairs.
And the Delhi police is questioning Mr. Srinivas, asking how he's managing to help the public if the center isn't. That really is a question everybody is asking. All right. Thank you both for joining us on this big question.